is Andrew. I just did a study abroad in Antigua, Guatemala. I spent 2 weeks there at a medical project and worked in the clinic there in San Lucas. So during my time there, I got to work in a pre-consulting area where I helped take patients' temperature, blood pressure, and weight. And one of the things that we would do there is that we would also try to find out if they've been sick, if they had a cough, and we would record that for our doctors there. What's unique about the free clinic is, like I said, it's a free clinic. It makes it so that those who don't have the money or the means to get access to healthcare, they can come here and get what they can at the bare minimum. I mean, honestly, the only thing they could really get was really the blood pressure taken, the weight taken, and their temperature taken, and then the doctors can give them some notes, some information from what they can gather, and then at the same time give them referrals to go to different hospitals. What's unique about it is that people have to travel far for this area, an hour to 20 minutes to an hour on a bus ride just to get there. And a lot of our women we came across were pregnant women that were, coming along in their term. And some of these women, unfortunately, couldn't come out as often, so they only had maybe one checkup prior to the end of their term. So that was, a sad but unique, sad and hard thing to watch, to see, because just like in the U.S., we have women that are coming in daily and always getting checked, and even if they had a hard time getting access, there was Medicaid and Medicare that helped them be able to get that access and be able to utilize the service they had there. One of the unique things we had was a doctor named Dr. George. He gave us a lot of really insight into what he sees and what he thinks needs to be helped here in the people of Guatemala. He said that one of the big things, oddly enough, was education. Teaching people about the concept of safe sex, teaching people the concept of how to eat nutrition. He also talked about just knowing what things are available for them and what they can do about it. Because going back to the part where he spoke on sex education, a lot of these women were really young. They were 15 or 16 years old that would come in and get checkups because they were pregnant and so young too. He says that most women in Guatemala are typically around the age of 10 to 12 years old, and that's a really sad concept as well, and really hard to hear and listen about for these women, because another one was air quality. A lot of these people had chronic obstruction of pulmonary disease, and it's just because of pollution. And I can remember walking through Antigua and Guatemala and realizing, wow, there's just so much pollution and so much, because they don't have smog checks. They don't have the same thing here in the U.S., and that's something that can cause respiratory issues and cause later on like acute chronic diseases and respiratory diseases. So it can just open your eyes to know that we need to find ways to branch out outside of our U.S. and study abroad like this are helpful, but we need to come up with more initiatives. And so that's just some of the aspects I'd like to share with you. I'll share more throughout the rest of this video. Thank you. Hello again. So after doing a few more videos and showing the wonderful staff that I got to work with Dr. George, Dr. Lorraine, Nurse Kim, they were amazing staff, and I really had the opportunity. And it just really made me realize after doing this trip and working with these people, it helped me see that an individual level, like how to help us to see it at public health at the individual level and help us find our starting point, because I feel like with these kind of perspectives and experiences, they help us look beyond just the data and the research that will only give us so much insight to global health. So when I was working there and talking with doctors, nurses, and patients, it helped me to be able to come together and collaborate on some of the things that I could take back to the U.S. and maybe just suggest what we can do to help those people beyond our borders. Like their needs, their wants, and the barriers that they face every day. Like I said before, the Dr. George who was talking before, he said the barriers that they were facing a lot of the times was education for these patients. But not only that, but also the funding. They were telling us about how corrupt their government was, that their clinics, their hospitals weren't getting the proper funding to help give them the needed resources to make it better, and it was just hard to see that. I feel like having these personal experiences, having testimonies of these witnesses of like what we saw and experienced out there, I feel like it can drive global health a lot more, because it expands our mind. It adds more knowledge to what we don't already know, to what we will learn, and that we will be able to later apply. Like the concept of socioeconomic determinant status. I mean, the concept is it's a very tough subject, but seeing conditions like this of people who live in poverty and people who have very little access because of that makes it really tough and heartbreaking. I think one of the most heartbreaking stories for me was seeing two mothers come in with children who were between the 1 month to 3 months, and they were only weighing 5 pounds, and that's because they were sick and they were their nutrition was not being up to date because they only had so much, and it was just hard to hear that. I think one of the major differences that I've been seeing between our host country and this area and in the U.S. was really just the severity, like the big differences of socioeconomic determined status. Because in the U.S., we may be in a status that allows us not to be able to get the access to health care or pay for it, but there are things in place by the government, such as Medicaid and Medicare, that can help take care of us if we're not able to. Whereas there, they don't have that. They had hospitals that required patients to purchase the tools needed for their surgeries or treatments and bring them to the hospital. And that blew my mind, because not many people can afford things like, if you want to get yourself an appendectomy, you would have to buy some of the equipment that is necessary for that surgery. And so that's a difference that I hadn't seen. And so, but that's because of their issue with funding. And so that's one of the things that they had to do. So anyway, thank you for your time, and I hope this is informative.